Alright, so first thing is we're going to get our order. We have our patient Charles Marvin, date of birth 02/14/1927. Is allergic to calcium channel blockers and hydromorphone. So I'm going to go into the med room with my MAR sheet. I'm going to pull my meds and do my med checks. So the first thing is I'm going to get my digoxin. He is ordered 0.125 milligrams. That's one tab. So I pulled my digoxin, 0.125 milligram tab. Digoxin, 0.125 milligram tab. And digoxin, 0.125 milligram tab. Alright. Next, we have Cipro, so I'm going to pull his Cipro. He's ordered Cipro, 500 milligrams, one tab. We have our Cipro, 500 milligrams, one tab. And our Cipro, 500 milligrams, one tab. Alright, and so next we have our multivitamin. So this will come in a suspension. He's ordered 10 milliliters daily. So we have our Centrum liquid for adults, 10 milliliters. So I would take my Centrum, pour it in my med cup. So we have 10 milliliters here. So we have the Centrum liquid for adults, 10 milliliters. And Centrum liquid for adults, 10 milliliters. So we have our 10 milliliter cup right here. And next we have our lisinopril. He is ordered 20 milligrams, and we are supplied 10 milligrams. So we're gonna pull two tabs. So I got two tabs. So we have lisinopril, 20 milligrams, two tabs. Lisinopril, 20 milligrams, two tabs. And lisinopril, 20 milligrams, two tabs. So we're good with that. And then finally we have our furosemide. He is ordered 20 milligrams, and we are supplied 40. So we're gonna give half a tab. So I got my half a tab of furosemide, 20 milligrams. So half a tab, furosemide, 20 milligrams. Half a tab, furosemide, 20 milligrams. All right. Next, we are going to check to see if they can be crushed. So I have my chart here. So we're gonna go with furosemide. We have our half a tab. Can be crushed. So I'm going to check that off. We're good with that. Then we have our lisinopril. We have our two tabs. They can be crushed. So we're good with that. Then we have our Cipro. Cipro cannot be crushed. So I'm going to call pharmacy, ask if they can send up a different form of Cipro so my patient can receive his antibiotic. So we will hold that medication. Then I have my digoxin. We have a 0.125 milligram tab. This can be crushed. So check that. And so for our multivitamin, we're not crushing this since it's already in a suspension form. It's already liquid. So I'll put that. Then I'm going to check compatibility with the rest of my medications. So we have digoxin, our multivitamin, our furosemide, and our lisinopril. I plugged those into the computer for compatibility, and they are all compatible. So then I will put these in our med cups. And then I'm going to have my flushes. So for our first, we have our liquid vitamin. I'm going to add 30 milliliters. And then for our flush, 10 to 15 milliliters. Our med, 30 milliliters. Our flush, 10 to 15. Our medication, 30 milliliters. Our flush, 10 to 15. Our med, 30 milliliters. And then for our last flush, we have 30 milliliters. All right. So then, now that I have all my medications ready, I'm going to do my pre-assessment. So I'm going to go into the patient's room, wash my hands, and if they were hooked up to suction or getting a feeding tube, I would have stopped it 30 minutes prior to giving the medication. Along with, right now, I would check their blood pressure and apical for their lisinopril and digoxin, and then I would check their potassium with their furosemide to make sure everything is good. Dig also has a therapeutic level, so I'd also make sure if it's in there that they're between the narrow margin for therapeutic level. And then next, I'm going to check placement of the NG tube. When I check for placement, I'm going to raise the head of the bed up and make sure they're in high followers. So I'm already washed my hands. I'm going to put my gloves on. And then I would make sure I'm in the right room and check their name and date of birth and any allergies. So I go ahead and introduce myself and help identify the patient. So I'd ask for their name and date of birth. Charles Marvin. Date of birth is 02/14/1927. And any allergies they have, which is the calcium channel blocker and hydromorphone. And then I would explain to him that I'm just going to check for placement. And inflate 10 cc's. Here is swoosh. And then I would aspirate. And then check my pH strip. So my pH strip will tell me if it's stomach contents. So my pH strip says it is. So we're in good shape. We're in the right place. So first thing is I'm going to flush with 30 cc's. So flush 30 cc's. And then give my med. Make sure it goes down. Flush. Making sure it goes down. Give my med, making sure it goes down. Flush, making sure it goes down. Give my med, making sure it goes down. Flush, making sure it goes down. Medication, making sure it goes down. and flush. Making sure it goes down. And I'll take this off, clamp it, and like I said, if they were hooked up to suctioning or tube feed, I'd come back in 30 minutes and resume either of them. Then I would also document on the medications I gave, the ones I held, and then the intake of the fluid as well, I would document. And then I would take my gloves off, wash my hands, and then I would make sure the patient has all their belongings and the call light within reach.